Academy, this is Miss Satterley. So I'm going to make a video about the skull. This is probably going to be a little lengthy, but remember you guys can pause it as you do this. On the bone book, there are 5 different views of the skull, and I'm going to be referencing those pictures as I go through this, but I just want to go over some of the general structures on the skull itself before I look at the pictures. So I'm going to start with the face. So this is the face. So this has the facial bones. The bone at the top, this is the frontal bone. So it's also called that because of the frontal region. And then inside the eye socket, you have a couple different bones. The one right here, the very inner one, is the lacrimal bone. I mentioned in class the lacrimal gland. That is actually where your tears come out. So that's the front one. The one back here that looks green, kind of looks black on the picture, that's the ethmoid bone. And the ethmoid bone can actually be seen on the inside of the skull. So if I move it here, this structure up here, this is the ethmoid bone, part of it. This is called the cribriform plate. Inside the cribriform plate, there's small holes called olfactory foramina. And those olfactory foramina, olfaction is a sense of smell. So that's where the nerves go for your sense of smell. There is a portion of this that sticks out called the crystal galli, but the entire thing itself is called the cribriform plate, and it's part of the ethmoid bone. Now the next one is the sphenoid bone I want to point out. The sphenoid is this one right here. It goes across, it spans the entire skull. On the inside, when you're looking down, it kind of looks like a bird almost. So this is the sphenoid bone. Actually has a lesser wing and greater wing. The sphenoid bone actually has an optic canal in it, and that's what these are right here. So that's where your optic nerve is going to connect from your brain to your eyes. So this is the sphenoid bone. If I change the view and look on the inside of the eye socket again, it's actually that right here. It's also pink. And it also can be seen on this side right here, the sphenoid bone. So that's the bones that comprise the eye socket. Right here is the nasal bone. It's named after the body region that goes with that. Your cheek has a special bone. This is called the zygomatic bone. And the structure right next to it is called the zygomatic arch. It actually connects the zygomatic bone with the temporal bone, which can be found right here. The temporal bone is where your sense of hearing is. This is one of the canals. This is the external auditory meatus. That's the hole, and there's an internal acoustic meatus where, if I can imagine, it actually comes through, and it is right here, the internal acoustic. It's very hard to take a skull and to look at the pictures and correspond. So I understand that, so we will take some time with that. I'm going to finish going down the facial bones here. So we did the nasal bone, zygomatic bone. This is the maxilla. Maxilla is the upper part of the mouth. And then this is the mandible. The mandible is a single bone, which is how the mandible is in mammals. Reptiles actually have a split mandible, which is why snakes can swallow really big prey, because they can split that mandible. But a single jawbone is a mammalian characteristic. Let's look at the back of the skull. The back of the skull, right here, this is the occipital bone. The occipital bone has a structure called the external occipital protuberance, which is what is colored here in yellow. So these are actual structures that I have asked on past practicals that I have colored here. I want to look at the bottom of this now. There's 2 processes. So you had to define what a process was. A process is any kind of bony projection that comes off of any of the bones. Well, the skull itself has two bony projections or processes. The mastoid process and the styloid process. Now, the mastoid process, I'm going to put this like this. There we go. Maybe. Oh, there we go. It's kind of mirrored, so it's hard for me to. Right here, this is the mastoid process. You can actually feel this in the back of your skull. This is the part of the skull where muscles for mastication or chewing is attached to. So, mastoid process. Females and males actually have slight differences in their skeletal structure, and this is one of them. Males are going to have a larger mastoid process than a female. So this is a very pronounced mastoid process. I'm going to grab a different skull here. Now, these are all fake, of course, but some of them do have structures that we can use. So this one right here, why can I not figure out how I had it before? Oh, there we go. So this mastoid process, which is teal right here, that's much smaller than the mastoid process on the other one. So this would be more of a female mastoid process. Now, again, these are just fake skulls, but this is probably modeled off of a female skull, and the other one is a male skull. Now, the other process I want to talk about is actually called the styloid process. The styloid process is it's colored in orange on this skull, but it's this pointy thing right here, and that actually has muscles that attach to your hyoid bone, which is in your neck, and other structures there. Okay, now that I have it flipped over like this, I'm going to look at some other bones. I'm going to bring it down a little, I think. Okay. So the roof of your mouth, it's called the palate. And that's actually named for one of the bones in the roof of the mouth, which is the palatine bone. Now, the palatine bone is this right here. It's kind of hard to see, but there is a division there. Okay, you can kind of see it. So right where the screw is, that's actually in the maxilla. Then there's a faint line that separates the maxilla from the palatine bone. So the palatine bone is part of the roof of the mouth, or the bony palate. If you think of a palate is how something to do with taste, that is that structure. Another bone is the vomer bone. This is the vomer bone right here. It actually sticks out. I had you guys feel that in class the other day. This pointy structure right here. Now, inside the bone, inside the nose or nasal cavity, we have what's called the perpendicular plate, which is right down the middle, and then the inferior and middle nasal conchas. And I will talk about that more when I get the pictures out to go over them. Now, there are some structures I want to point out while we're looking at the front of the bone before I finish the top of the head and talk about that. So these are actually foramens. Anytime you see a hole on a skull or any of the other bones, we have a foramen. There are three very pronounced foramen on the front of the skull, and they're named after their locations. So if you remember your body regions, well, if you don't remember them, you really should take some time to review them because that'll come in handy. The chin region itself is called the mental region. So this foramen here is actually termed the mental foramen, and there's one on both sides. And that's where some of your nerves will run through that innervate your chin. Now, at the top of here, this is the orbital, which was the ocular region. This is the eye socket. And this is where we have two separate foramens that allow nerves to go through. This top one, we learned directional terms. Superior and inferior were two of them. They're going to come into play right now. This is actually called the supraorbital foramen. And this one down here is the infraorbital foramen. So they're named after their location in relation to the orbital or the orbit where your eyeball goes. Now I want to look at the top of the skull. So this is the brain case. This actually has pieces of 4 different bones, though 2 of the bones have the same name. So this one right here, this is the front of the head. So this is the frontal bone. And then next to it, we have the parietal bone. There's 2 parietal bones right here. In the very back, we have the occipital bone, and the rest of that is on the other half of the skull. Now you can see I have some lines drawn on here. These are sutures. Sutures are interconnections between bones that when you're younger, they are not fused quite yet, but as you age, they will fuse completely. When a baby comes out of the birth canal, sometimes their heads can be misshapen, and that's because these sutures are not formed yet, and that's on purpose, so the skull's able to fit through the birth canal. There are 4 major sutures on the skull itself that I want you guys to learn, and they have to do with the planes, some of them. So this front one, if you were going to cut the head right here, you get the face intact and the back of the head. That's the coronal suture because that's a coronal plane. Now the one straight down the middle, we had mid-sagittal and parasagittal. So mid-sagittal, the suture actually isn't mid-sagittal, it's just called the sagittal suture. Now the back of the head, where the parietal bone connects with the occipital bone, that is called the lambdoidal suture. There's one other suture that I'm going to point out, and it is called squamosal suture, and it is not drawn on here, but it actually is this suture right here. So that's the suture that connects the temporal bone and the parietal bone, which is the bottom half of it right there. Now I want to take a look at the pictures from the bone book itself. So I have printouts that I'm going to use to reference. Now on these pictures, they are in color. Color is not important. It just kind of helps you determine the different bone structures themselves. So one is a suture. This is actually the suture that goes right down the middle of the skull, which is pictured in green right here, and that is the sagittal suture. Number 2 is also a suture. Again, a suture is just a connection between 2 bones in the skull, and it looks like it has a kind of a zigzag looking pattern. This is the suture that connects the frontal bone with the parietal bone, and that is called the coronal suture. 3 is also a suture. This is the suture between the temporal bone and the parietal bone, and that's called the squamosal suture. Now 4 is a structure that I've already pointed out. 4 is the supraorbital foramen. 5. I have not talked about 5 yet. Again, it's a little hard to see because of the glare on here. You do have these pictures in your bone book, so that's what I want you to reference whenever you're doing this. But you can use the verbal words that I'm using to help you fill this out. So 5 is actually the optic canal. And the optic canal I pointed out, if I look at the skull again, it's right here. Number 6 is the superior orbital fissure. So it's superior, it's on the higher part of the orbital. A fissure is another type of opening inside the skull. So it's a superior orbital fissure. Number 7 is pointing at the zygomatic arch. The zygomatic arch connects the zygomatic bone with the temporal bone. Number 8 is this foramen right here, and that is the infraorbital foramen. Number 9 is pointing out one of the processes that I talked about that's larger in males than in females, and that is the mastoid process. Number 10 I talked about, it's that little bitty bone that points out there. That's the vomer bone. Number 11 is another type of suture. It's called the intermaxillary suture. So it's the suture between the 2 maxillas. I actually have 2 of those in the face. They connect at that suture. 12 is pointing at the jaw. I have the word bone here for a reason, so you don't accidentally put mental foramen. 13 and 14 are both named after the region. 13 is a protuberance, so it's called the mental protuberance because it's on the chin. And 14 is the mental foramen. 15, I have bone here for a reason. 15 is the maxilla. 16 and 17 are inside the skull. Those are both nasal conchas. The 17 is the middle nasal concha, and 16 is the inferior nasal concha. 18 is pointing at the zygomatic bone. 19 is pointing at that perpendicular plate, which I did show you on the bone itself. And 20 is pointing at, it should say bone next to it. That's the lacrimal bone on the inside of the eye. 21 is also a bone. That is the ethmoid bone. 22 is the temporal bone. Again, that's where your hearing is at. 23 is that sphenoid, which you can see the purple runs throughout in this picture. 24 is the two sides of the skull, which is the parietal bone, and then 25 is the frontal bone. So that is the first picture of the skull. This is the anterior view of the skull. I'm going to go through some of the other parts of this. Next, I want to do the lateral view. So this is the outside view of the skull. I'm going to go through this more quickly because most of these structures I've already mentioned. So one is the suture down the middle. I'm actually not going to name these. 2 is this bone here, the frontal bone. 3 is that side bone that goes across the skull, the sphenoid. 4 is pointing at this foramen. 5 is the nasal bone. 6 and 7 and 8 are all bones. So lacrimal bone, ethmoid bone, zygomatic bone. Number 9 is this bottom foramen. Number 10 is the maxilla. 11 is pointing at the foramen on the chin, which makes it the mental foramen. And 12 is this mental protuberance again. 13 is actually representing just that entire bone itself, the mandible. And then we have 14. 14 is pointing at the zygomatic arch. 15 I mentioned, it was colored in orange on my skull. That is that pointy process on the skull called the styloid process. And then 16 is the mastoid process. 17 is another one that I pointed out on the skull. That is where your ear is over the top of that. That's your ear canal, which is called the external auditory meatus. 18, this is kind of a bad view, but this is the bump on the back of the occipital bone, which is the external occipital protuberance. 19, temporal bone, occipital bone. 21, that suture in the back, the lambdoidal suture. 22 is the side suture, which is the squamosal suture. 23 is the parietal bone. 25 and 24, they're kind of hard to see on this picture, but there's 2 lines on the skull, and they're hard to see. I usually don't ask those in the practical because they usually don't show up, but those are called the inferior temporal line and superior temporal line, and that's just a place where a lot of muscles will attach on the skull itself. We're going to go into the inside of the skull. We're going to look at the sagittal section. Number 1, that's just the parietal bone again. 2, sphenoid bone. 3, temporal bone. 4 is that lambdoidal suture back here. 5, occipital bone. 6 is that external occipital protuberance again. Now we get to the complicated stuff. Some of this stuff we're pointing at things we haven't talked about yet. So 7 is pointing to the internal acoustic meatus. Internal acoustic meatus is that hole right there. If I look on the inside of the skull, the internal acoustic meatus is the structure right here. So the internal acoustic meatus. Number 8 is called the hypoglossal canal. Number 9 we went over, mastoid process. 10, styloid process. 11 is hypophyseal fossa. A fossa is a shallow depression, and that is that indentation right there. 12 is a foramen. This is the foramen on the mandible itself, not the front of it, but the inside. That's the mandibular foramen. 13 is a sinus. A sinus is a cavity within the bone itself. So this is the frontal sinus. That is, if you have a sinus headache, you have fluid in that structure right there. It's right above the nose. And this is called the sphenoidal sinus. And if you notice, frontal, sphenoidal, those are both named after the bone that they are inside of. 14 is the palatine bone at the back of the mouth. 15 is just the mandible. 16 is actually just pointing at a tooth. 17, this is actually the vomer bone. So it's a perpendicular bone that goes through. I know on the front you can't really see much of it, but that's because you're looking at just the tip of it. 18 is the perpendicular plate of the nose. 19 is the ethmoid bone. So you can see right here, 21 is actually pointing at the cribriform plate, and we're going to look at that a different view. But again, this is just the cut in half version. 20 is the nasal bone. 22, frontal sinus. 23 is a side suture, which is the squamosal suture. 24 is pointing at the frontal bone, and 25 is a suture across the top, which is the coronal suture. So right here, this little point in the inside of your frontal bone is actually called the frontal crest. Number 2 is the crystal galli. Number 3 is the whole thing, the cribriform plate. And 22, this is all part of the ethmoid bone. 4 is pointing at the little holes, which are called olfactory foramina. Foramina is only used a couple times, we'll see that, and that's when there's many holes in one location. There are several holes inside the skull. We don't learn all of them. I go over all of them, but I won't test you over all of them. So 5, there's a lot of them called foramens, because foramens are holes. This is a foramen rotundum. 7 is the foramen lacerum. 8 is the foramen ovale. And 9 is the foramen spinosum. All of those have different cranial nerves that actually go through them. 6 is the shallow depression again, the sella turica. 10 is the internal acoustic meatus. That is one thing I do want you to learn. And then number 11 is the jugular foramen. So inside the skull itself, I want to point this out. I have them color coded on this. You can see this is the mastoid process again, but then I have 2 holes here. One's red and one's blue. I have that on purpose. The one that's blue is the jugular foramen, and that's because it allows the jugular vein to pass through. Veins carry deoxygenated blood, which in diagrams are traditionally drawn as being blue. Now, this one is the carotid canal. The carotid canal has the carotid artery that goes into it. That is the major artery that supplies blood to the brain, which is why it's red. So jugular foramen and carotid canal. Again, this is the external auditory meatus. On the inside, you have the internal acoustic meatus. And we haven't gotten to this yet, but this is called the mandibular fossa. And then this large hole right here is actually the foramen magnum, big hole. That's literally what that means. That is where your brainstem will rest, and that's how your spinal cord attaches to your brain. Number 12 is just the bone, the occipital bone. 13, I just said, was the foramen magnum. Now, inside the skull itself, there's 2 fossas. Fossas are shallow depressions. I have them colored on another skull, which I don't have at the moment. But inside here, this depression down here is called the cerebellar fossa. That is where the cerebellum rests. That's where the cerebrum will rest. So again, 14 is the cerebral fossa. 15 is the cerebellar fossa. Now 16 is pointing at that side of the head bone, your parietal bone. 17 is temporal. And 18 is pointing at the optic canal. Again, that's where your optic nerve will run through. I need to change this right now. So everyone, you're supposed to be watching this anyway. 20, this arrow is actually supposed to be here. So 20 is supposed to be the sphenoid bone. 19 is the greater wing. And 21 is the lesser wing of the sphenoid bone. 22 I went over already is the ethmoid bone. That's this green bone right here. 23 is pointing at this opening right here, and that is the superior orbital fissure, which I mentioned earlier. This is just a different view of it. 24 is the frontal bone, and then 25 is this little thing right here. That's called the clinoid process. So we are on the last picture of the skull. I am going to go ahead and do the mandible as well with it, since we're talking about it. This is if I'm looking at the skull underneath. I've already showed you. So this would be the same view like this. It's different. We have the foramen magnum again, the carotid canal, jugular foramen, mastoid fossa, zygomatic arch, mastoid process, and this is actually the styloid process. It's just very small on this. These are called the occipital condyles. And this would be the external occipital protuberance, mastoid process I just did. All right, so let's look at the picture. Number one on this particular view we haven't had yet. It's called the incisive fossa. So these are called incisors. So that's behind the incisors is where it gets that name. 2 is the palatine bone. 3, zygomatic arch. This is called the pterygoid process. And some of these foramens again. 5 is the foramen lacerum. It's in there. 7 is the carotid canal, which means 9 is the jugular foramen. 8, external auditory meatus. Temporal bone is 6. Squamosal suture. This one right here is called that occipital condyle. Foramen magnum. External occipital protuberance. 14 is the superior nuchal line. That's one that I usually don't ask. 15, occipital bone. 16 is the lambdoidal suture. It's kind of hard to see. That's just a very little bit of it. 17, this is actually called the condyloid fossa. That's right by the occipital condyle. 18 is the mastoid process. 19 is the indentation on the skull where the mandible actually fits in. So that's the mandibular fossa. 20, styloid process. 21 is the foramen ovale. 22 is the vomer bone. 23 is zygomatic bone. This is the greater palatine foramen. This is next to the palatine bone. And then maxilla. So that is the skull. I do want to quickly go over the mandible, since the mandible is part of the skull. Number 1 is the ramus. A ramus is anything that forms an angle. So that's like this whole thing. 2 is just this little piece right here. That's called the angle. So the ramus is this whole thing right here. And 2 is just the angle itself. It's technically the angle of the ramus. Number 3 is referring to the body. 4 we've had already. That's the mental foramen. 5 are called alveolar process, and that is the processes that all of your teeth fit into the skull. 6 we talked about. That's the mandibular foramen. Then we have a few more things. I'm going to skip over to 11. 11 is actually the mandibular condyle. A condyle is a rounded process. 10 is the mandibular notch. 9 is actually referring to the joint itself. So it's a temporal mandibular joint. You may have heard of TMJ. That's temporomandibular joint disorder. But that's what that number 9 is. And then 8 is the part that corresponds on the skull itself. So 8 is the mandibular fossa. And the last One is 7, and that's actually a type of coronoid process. And that is the skull and the mandible. Well, you've already watched this video, so I will have added typed in words so you know how to spell this stuff. And that'll be inside the video. So if you have any questions, please let me know. Bye.